Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Global Partners makes trips really in 3 different locations, really throughout the world: Africa, Nicaragua, and Pine Ridge. And one of the places that Dr. Dana Benden goes to on a regular basis to address a variety of health needs is Nicaragua. Joining us is Dr. Dana Benden to talk a little bit about what they do down there. Thanks for joining us.
You're welcome. Good to be here.
Cervical cancer. That's what your focus is when you go to Matagalpa. Why cervical cancer and why Matagalpa?
So Nicaragua actually has one of the highest death rates from cervical cancer in the world. And when Global Partners was trying to establish their initial sites for where we would go and do outreach and volunteerism in the medical field, we looked for an area that was underserved, and we looked for different medical initiatives that really needed to be addressed and were priorities of the country that we were in. So when looking, Nicaragua was identified, and in particular northern Nicaragua, which is where Matagalpa is a very underserved community in Nicaragua. So in northern Nicaragua, it's a more rural community. It is not very well served by medical providers, and there's not a lot of support for patients in that area. So in establishing the site, that's how we chose Matagalpa. We have worked very hard to try to align with the government and their healthcare system and different organizations that are working in that country on a regular basis to try to really help support the work and teach and train the providers that are there in that area. And it is very clear that cervix cancer is a problem. And it's both an access problem and an equipment and resource problem. So we had partnered with a clinic called Clínica Fara that is in Matagalpa, and their primary goal was to really try to decrease cervix cancer in that region. And they are a great organization that has been provided to women either free of charge or very minimal charge. They have asked us to help with training and with the capacity to be able to see patients and screen for cervix cancer, treat precancerous lesions, and help to do some treatment of women when they are diagnosed with cervix cancer.
You're going to be going down in June, June 22nd, I believe. There's other trips planned for later in the year, and we're going to talk a little bit more about how others can get involved in not necessarily just talking about cervical cancer, but in educational opportunities. But I want to talk about what's a day like when you, as a provider, go down in June. What is a typical day going to be like for you?
So a typical day when we're working with our partners at Clínica Fara is screening patients who might have had an abnormal Pap test, which is a screening test for cervix cancer. We might do biopsies and treatments for precancerous lesions. We perform cystoscopy. We also partner with an organization called Lily Project in Nicaragua, and we go to much more rural communities. We work in a building that usually doesn't have electricity or water running, and we will screen patients in that facility really closer to their home, because a lot of the barrier of women getting screening tests and treatments is really the proximity to care. So in working with Lily Project, Global Partners really goes out to the rural area. We see patients where they live, and we do it in more rustic settings, but are still able to help provide them great care. We also work with the medical personnel in that region to help train them so that they feel comfortable doing the screening tests.
I want to talk more about that training. We're talking with Dr. Dana Benden, Gundersen Health System, and her trip getting ready to go in June, June 22nd, for Global Partners. The training is a key component because at some point you're going to leave, and the team is going to leave. But what you want to leave behind is the knowledge that you bring with you. Can you chat about how important that is for the Matagalpa region?
Absolutely. Global Partners as an organization is really dedicated to teaching and trying to have a sustainable effort. And so in order to have a sustainable effort, you really have to be able to provide education and training to the individuals that are providing the care in the area. We go to Nicaragua 4 to 5 times a year. But all of those other days that we are not there, we want the skills that we have to be able to be translated and performed by their own providers. So we do go back to the same area. We work with the same providers until we feel like they have gained the knowledge that they need and really they feel comfortable in providing that care.
Talk, if you would, about when you go down, why you go down. I know you're going to say, oh, it's for the patients and the families that are in that area, but there's something that the team is getting out of that. What is that?
So for me, I had a very close colleague whose name was Dr. Rick Renwick, and he was very dedicated to Nicaragua. He actually did a medical school experience there. And Dr. Renwick was actually scheduled to go to Nicaragua to launch this cervix cancer prevention program. And unfortunately, Dr. Renwick died tragically in a plane accident. He was a very close friend of mine and a mentor, and I looked up to him, and I did not want his legacy to die. So he really inspired me to kind of fill into his shoes and the void that he left behind. And I'm very happy that he did. It is a great experience as a medical provider and a volunteer to see a different atmosphere, to work in different settings. People are very grateful. It's very rewarding, oftentimes more for the volunteers than it is for the people we're teaching. It really gives you a different perspective of what we're grateful for and what resources we have and how we can use resources a little bit better.
I want to warn people that this is not a vacation. When you go down there, you're working very hard, long days. But there are other opportunities if you don't happen to be a surgeon, but there are other educational opportunities that you're encouraging folks to learn more about through global partners and potentially go along to places like Nicaragua, to Africa, and to Pine Ridge.
Yeah, we have roles for many different, different opportunities for different volunteers depending on what skill you have. We have many teachers that travel with us. We have many non-medical personnel that come with us. And there are different trips that people might fit into better. But I think that it's really a great experience. We oftentimes have college-age students or different people that are coming in and just learning about the project. We partner with Rotary in La Crosse and different organizations, and they might volunteer with us also to have that interface of what it's like to work on a project.
Making a difference in Matagalpa, Nicaragua. I really appreciate your time here today, and good luck on the trip in June and the trips this fall as well.
Thank you.
All right, Dr. Dana Benden, and if you'd like to learn more about global partners, you can go to the Gundersen Health System website. Look for the foundation. You can search that right on the Gundersen Health System website. That's gundersenhealth.org.